You have to give me the one with the strangest name. All right, I'd like to start by first thanking everybody for coming. It's a fantastic opportunity to present our work. And the first word is actually to say that I know that by doing Movember I play to my Portuguese stereotype, but please bear with me and just look at the slides, don't look at here. All right. So cyclophosphamide and treatment of ovarian cancer, something that I'm very lucky I'll probably never suffer. There we go. So cyclophosphamide, or CTX, as we in the field we usually call it CTX, is like mustard. So it's an agent that we can either spread on some really nice bread and a sausage, or we can actually also use it to treat a range of diseases. Now, alternative therapy for some patients, and I'd like to emphasize just for some patients that have platinum, so rich patients. So this is something that can be used for patients that are actually rich. And because they're rich, they can avoid having ovarian cancer. We had a couple of other tables I'm not going to present, so I'll skip directly to table 3, where we asked some people some questions, and they've responded to CTX by predicting factors. And I just like to emphasize this box here, which is very important. That's why usually when you see in a presentation a box like that means that you should direct your eyes at it. So we asked 10 patients, and these 10 patients gave us 3 answers. Now, as you can see, these rich patients are not always the most smart patients. So a response rate of 30, of course. So the modes of this mustardy component, the efficacy, so it has effects on the tumor and it has effects on the host. So for instance, if usually this happens in late night talk shows, there's someone there talking, being interviewed, they usually consider tumors of society. And then there's the host, so this can have, you can see it like that also. So I'm sure you all can read, and I won't be able to go through all of that, but just know that it's a circle, but it actually comes from the mustardy CTX and then synergizes and goes boom, and that's, yeah, so that's what happens. Now, for such a important mechanistic way of defining ovarian cancer, this is a very small graph, I understand that. But I'd like to talk to you about high-dose mustard in CCR expression of CD4 T cells in patients with MS. I would not like to describe at the moment what MS is. We're still trying to define it correctly. But what you can see is that, first of all, these patients are colorblind. So what happens is they see everything in black and white and shades of gray. And talking about, no, we're not going to talk about shades of gray, but since this was ovarian cancer, it might have, anyway. So what you can see is that there's a really big white bar and smaller colored bars, which is not very politically correct. But, yeah. Anyway. So, in reality, does low-dose mustard influence the expression of this receptor on T cells in gynecological cancer? So you see how suddenly we were talking about ovarian cancer, you thought everything was fine, and boom, I introduced gynecological cancer. And there you go. This is why it's such an amazing field to work on. It keeps bringing surprises, and yeah, you can be CCR4 steady or CCR4 can spike. You never know what's going to happen. Anyway, what does happen is that these patients that are that have a lot of platinum, they survive longer than patients that don't have. So if you have a steady amount of platinum, you die fast. But if you have spikes of platinum, suddenly you're better off, and there you go, you survive for longer. So in conclusion, low dose, so CTX, I won't say that name again, increases the frequency of this receptor in T cells in 40% of patients. I hope I've shown you that. patients that have an increased frequency of this receptor in T cells survive longer, you saw that. But what they really mean by T cells is dough, money, platinum, whatever you want to call it. What's the clinical relevance? Well, that's a question that we pose ourselves every day, and there's still no clear answer. We can say that it could potentially be used as a marker, although we do have markers in the lab, we use them all the time, so why would we need another one? Maybe a different color? So understanding this mechanism is definitely very important. Thank you very much.